Please welcome Barbie and one of her orthopedic physicians, Dr. Ron Hansen, to the show. Welcome.
Thank you.
So, really, you're using relatively new technology here. And so, Barbie, you're someone who, how recently did you have this injection done?
Monday morning.
Monday morning. So, probably not going to see a lot of results in just a few days, correct?
Actually, it depends a lot on the patients. Most of them start to feel some relief within a few days to a few weeks. All the patients actually walk out of our office, and within 3 to 4 days, they're actively exercising to help the stem cells know what to become.
So you're feeling better already?
I feel great. Before this, I was having trouble walking. I just went like that, and my knee had to be iced for hours.
All right, so do we have some footage of you? Earlier today.
This was after
look at you navigating the stairs there. So
yeah, 3 days after having this procedure, I'm fine.
So knee, it's a pretty big joint. Is this being used in smaller joints as well?
Yes, thumb joints, small joints in the feet, and tendons and ligaments, very common thing that we work on as well.
I have to ask your permission. Can we look at your MRI?
Yes.
So this is your knee MRI. Let's go over and look at this MRI really quickly to show some results to the viewers. And I want you to highlight, because some people may not really be able to tell what we're looking at. So this is her knee joint before.
Absolutely, Dr. Travis. This is the lower bone, or the tibia, and this is the upper bone. This is her cartilage lining her tibia, the gray on either side. She's starting to lose some cartilage. That's the white area in the middle of all that gray, which is going to eventually erode everything around that area. Now afterwards, that area is completely filled in. There's gray, all the same and similar color all the way around it.
And I'm going to highlight just so everyone sees what, this is the femur bone on top of the tibia bone here, right?
Yep.
And this is the joint space. And so even though it's really subtle for people at home, this little bit of white there has been improved. The cartilage is literally improved before and after. Now, this is a knee. But you're saying that you're also using this for other things, and what we have here is a picture of a rotator cuff tear. So walk us through before and after an injection here.
This is the ball of the shoulder, the humerus. And the tendons coming across here, the rotator cuff. You can see here, there's a large gap from here to here. That was read by the radiologist to be a 1-inch gap in his rotator cuff, supraspinatus rotator cuff tendon. Afterwards, this is 7 months later, with a procedure that took 1 day to do, he's got this one little spot left.
So this one little spot for everyone. And I don't expect everyone at home to learn how to read MRIs based on this, but what you're seeing here is an injury that typically takes 6 months plus, healing much more quickly. And as we go back and talk to Barbie, one of the things I want to ask you is, people will hear your story and they'll say, oh, wait a minute, this is too good to be true. This is really still in its infancy.
Still in its infancy. We spent all of our time making sure that the procedures were safe and that they were effective. Not everybody is a candidate for this, and we're very careful to tell people what they can do to improve themselves, things that they can do to help their chances of doing well with or without stem cell therapies. And
that's a great take home. There's so many things we can do to improve our joint health that goes beyond just surgery. Barbie, we're so happy that you're feeling better.
I no longer feel like I'm 80.
Good luck on the hike.
Yeah.
All right, we look forward to hearing about Dr. Hansen. Thank you for coming on.